Great. Welcome to today's session. Thank you so much to the organizers. That's Sis the Light Foundation, the East Africa Community Mental Health Network, of course, and ENASO, which is a regional body of civil societies and community groups headquartered in Arusha, Tanzania. We do appreciate this opportunity to have discussions around maternal mental health. I know we've spoken so much about maternal health, but we're trying to see the nexus onto as to how the mental health aspect kind of feeds into the whole collaboration and discussion. And we know of late, mental health has been on everybody's lips. People are discussing and people are openly coming out to identify how they can help um, family members, they can help colleagues, friends, neighbors. But then today's crucial discussion is around the the mother, the young mother, the mother who's giving birth, the mother who has to go through all these changes. But we always appreciate when there's a new baby brought into the world. But there's so many aspects around the mental health of a mother that we also need to address. These are things that have been there for quite a long time, but we just have been addressing it more privately or actually been turning a blind eye to it. But as of today, we are discussing why would maternal mental health be something of interest? Why do you want to have this discussion openly? And honestly, when you're joining, the question would be why would I concern myself with this? It looks like it's a female issue, it looks like it's a mother issue, so you don't have anything to do with it. But we've seen that the setup of where the woman kind of leaves the hospital setup, postnatal setup. There's so many things that play into making sure that the woman kind of has a quick recovery. And we've seen there are a lot of stakeholders during that whole process. So then the neighbor comes in, the spouse comes in, the family setup comes in, society comes in. So everybody's involved one way or another. Now, maternal mental health is essential, but often overlooked because part of maternal, newborn, and child health, it's something that has all been gulfed into one umbrella, but the mental health aspect of it hasn't been discussed for long. So during pregnancies and the first year after childbirth, women may experience depression, anxiety, trauma, you name it. There's some mood swings and changes that at times you feel like you cannot explain it. But we're hoping that during this discussion, you kind of get tips and also kind of try to identify when these things are happening. Now, the World Health Organization indicates that about 1 in 5 women experience a mental health condition during the perinatal period. So we're looking at maybe things like depression, you being down, etc. The risk is shaped not only by clinical factors, but also some other factors come into play. So it could be the setup, the family setup, poverty. We also have the issue of gender-based violence or intimate partner violence, limited social support, especially when we're talking about adolescent pregnancy. This is an adolescent who's getting into motherhood, and it's a whole new terrain for them to handle. So that's why we're having this discussion, and we're hoping that therefore focus on early identification, respectful care, referral pathways, family support, community support will be things that will come into play. And that particular support will also help um, kind of make the whole process of childbirth on being a mom much more enjoyable the way it's supposed to be. So we're hoping, but by the end of this discussion, we'll take an hour 30 minutes. I'll do less talking, I promise, because we have experts who actually understand this discussion altogether. So we're bringing the experts in terms of the medical side, experts in terms of community. We actually have mothers on the call. So we're bringing that lived experience. And of course, this is not only a female discussion. We also do have Brian, who's going to bring in that male perspective and his expertise. And we're expecting that, by the time we're done with this conversation, you'll have learned something, and maybe we might have learned something from you in return. So let me just stop there and kind of bring in our first speaker, not really a speaker, this is like a keynote, but what I like is what is happening in Burundi. And of course, Leila Naomi Irakoze from Burundi is going to introduce herself briefly so that we understand what is happening in Burundi, what is she doing with her organization, which I can promise you it's interesting stuff, but also bring her in to kind of explain more about understanding maternal mental health. Let's just start there. Let's start from scratch. What is maternal mental health? Leila, if you're on the call, I'll just hand it over to you.
Yeah, thank you, Lizzie. Thank you for having me. I hope you are all hearing me. So, my name is Naomi Leila Irakudze, and I'm a woman with a lived experience in maternal mental health. And I'm the founder and executive director of Shamika, which is an organization that is dedicated to maternal mental health with a special focus on supporting mothers and parents through maternal losses. So, I would like to ask first of all to the audience who is there here, what what do you what a simple question. So when you hear the phrase maternal mental health, what really is very the first image that comes through your mind? What do you think is maternal mental health? So I will give you 3 seconds, 3 seconds to think. And if you are live with us, please write to the chat what you think is maternal mental health. Yes. Uh, if I can go on, for most people, the immediate picture of what maternal mental is, or what the picture of it is, a mother holding a new baby, a newborn, and the baby is crying, and that is like for here in Burundi, it's something that is really really big, but people don't talk about it. It's a taboo. Maternal mental health is it's more like there is no mental health needed in the maternal sectors. So what we commonly dismiss as postpartum depression, now we begin to speak about it, and but most of the people living in Burundi, and it's a luxury. It's a white disease, so it's not something that is common to talk about. I have a postpartum, or identify someone as someone having a postpartum depression. It's more likely that's a white people disease. So here we don't do that. So you are a mother, you got pregnant, and now you have a baby. So you have to assume you are a mother. There's no that part of maternal mental health. So going with my experience, uh, I carried my first pregnancy like in the latter. It was in the 7 years ago, and then I was excited. It was my first pregnancy. From the moment I heard that you are pregnant, I was like, wow, I'm going to give life. And from that moment, I have excitement. I have many things in my mind. I have a picture that I have of the baby. I was not, I didn't see yet the picture of the baby and in the ultrasound, but I was imagining what the baby will look like. And I was already having the baby in my arms, still in my thoughts. And then at 8 months, but at the first trimester, second trimester, I began to change. I was vomiting. I was not having. I was sensing a lot of fatigue, tiredness, and I was not I was my body was changing, so my mental also was changing. And what the common thing, we rely a lot on our aunts, our mothers, the communities around us to tell us about the journey, and they were all telling me that's normal. It will end. That's normal, but I was changing. And at 8 months pregnancy, I went to see the doctor for an ultrasound. And it's at that moment that the doctor told me, your baby is no longer alive. It was something shocking for me because I knew about miscarriage. I knew about neonatal losses, but I didn't know that I could lose a baby at 8 months pregnancy. And at that time, when he told me that, I was shocked. And the community around was like, silent. No one came up and tell me it's good. So pause yourself and breathe and let's navigate this together. And then they did. The baby was. I gave birth to the baby. The baby was not crying, but until at that time, I was expecting that the baby will cry. And after that, we did the bury. We buried the baby, and her name was Shamika. Shamika means blooming, and after that, there was those words about the community. It was like, you don't have to grieve for something that you didn't touch, for something that you didn't live, but the baby has been living for 8 months inside of me. I was hearing his heart when I go to the doctor, and I was feeling his the baby bumping in my belly. And then they were like telling me, you can do it quickly and search for another baby because now you see that you can get pregnant and give life. So move on, move on. And it's a part of that that after that I got to get again pregnant, and it was also a complicated pregnancy that didn't reach the time. And now I'm a mother of two girls, and but the what I have seen is that the mental health is something that you can if you are not giving it a good space and talk about it plainly and give space to the people to share their heart, that people may be lost forever, even if it's a mother who have kids who are alive, or it's a mother who is pregnant again. If you don't consider the mental health, it's something that it can destroy her life and the life of the children or the family that is there. So when we ignore now, we ignore most mainly the mothers when she's giving birth. We go quickly to see the baby and take a picture, post it on our status, and don't ask the mother, how are you? How are you navigating this transition? There were a quietly something quite, we are quietly losing that was priceless in Burundi. I don't know other in that others country. We understood that bringing life into the world was a major transition that requires collective care. We had beautiful practices where aunts, grandmas, mothers were moving in with the family for weeks, something for to pamper the mother, cook for the mother, nourishing meals, ensure that she rests and care for herself so that she could heal, and that would help on the mental health. But today, as life moves faster and faster, tradition fades. So our work is built on the firm belief that maternal mental health thrives in community, and that uh, and that even after the deepest grief and mental health struggles, healing and blooming are still possible. So, what is mental health, maternal mental health in common condition? I would say that first of all, we can look about the perinatal depression and anxiety. That those are things that we still now till now is categorized as it's a what disease. So we don't talk about it here. It's that it goes beyond the baby blues that revolves in few days. In our community, an anxious or depressed mother isn't always sitting around crying, but there are those mothers who are mostly present this physical trait. They complain of chronic headaches, the stomach aches, or they have extreme fatigues. They have no medication fixes, or she can become hyper vigilant, checking on the baby every second, every minute, terrified that if she falls asleep, something will happen terribly to the baby. And people might say she's being dramatic, she's refusing to eat, but actually it's her mother who's actually suffocating or is under anxiety. There is also that part of the That is rare, the perinatal psychosis, that is an acute medical emergency where the mother might start hearing voices or fearing that someone in the family wants to harm her baby or losing touch with reality. In many of our African communities, we attribute that to witchcraft, to ancestral curses or evil spirit, taking her to traditional healers instead of urgent psychiatric care or recognizing this as a medical emergency that can be saved. It's a life that can be saved. There is actually I think it's in US or Canada, where a mother killed her three kids, and she was telling her communities that she was not feeling well. She was
Mm-hmm.
having that perinatal psychosis. She was not feeling well. She was feeling tired every time, and she even admitted herself several times in the psychiatric, but they were dismissing her, telling her, "You are now good." But after all of that, she ended up killing her three kids. I don't think it's something that is screaming, it's screaming to us, and it's an alert saying that if we don't care about a mother to those stages because she's changing emotionally in the way she lives, she's suddenly becoming a mother, being responsible of a newborn for the biggest time, and she wasn't ready for that.
Mm-hmm.
So if we don't take care of them, they are losing themselves, and we can see the consequences in the communities. So what are the first? How can we notice that something is not going well to the for mothers?
Mm-hmm.
First of all, you cannot when you see that the mother is quiet, she's silent, or for a mother, she may be quiet, she may be silent, or she may have in her thoughts that she's not being a good mother. There are people who mothers who express themselves and ask to their people around them, "Am I a Am I a good mother?" And the first thing that we say is like, "Ah, you are asking too much. Yes, you are a good mother."
Yeah.
So if you don't
Mm-hmm.
do that quickly, or we correct them directly without giving them those space, this is something that is uh, they are coming to introduce to ourselves that there is a problem. They need a community to be with them. We can see them after a loss. A woman comes who becomes completely silent, stops speaking, or refuse to mention the baby, and the community will say, "Look how she's strong. She's not even crying." Because I don't know in other country, but in Burundi, when you begin to cry, they tell you, "Don't cry. You have to be strong. Don't cry. You don't need to cry.
Okay.
You are being dramatic. So don't stop crying." So when you refuse her to express herself, she will put it together in her heart, in her emotions, and we will begin to see it after that. We will think that she has moved on, but she didn't actually. And in the work in the healthcare workers, we are mainly considering the physical part. We ask them, "How are you healing physically?" But not every time a doctor can
Look
come
into,
or
yeah.
yes,
We don't
then
look into
don't come.
the psychological, the mental part of it.
Yes, asking the mother, "How are you today? How
True.
are you today? How do you feel
That's
today?" Because it's overwhelming, guys. It's overwhelming.
I,
It's a lot of emotions.
it,
And
I
those
can I
emotions,
can imagine, yes. And I can imagine.
yes,
I mean,
and
I like the fact that, now I can actually understand why your organization is called Shamika. Really,
yeah,
that's quite. I know when you started off, I've been looking at the expression of the other speakers, and that was quite touching. And we're
yeah,
talking about, and what I like is the fact that for some reason we always refer to an auntie. When you're pregnant, you'll find that it's not even your
yeah,
mom who's going to be giving you the advice. There's always an aunt somewhere who will. So there's that support
yes,
system, that collective core support system that always has been there. And of course, that is also dying because people are moving to urban areas, people are getting busy.
Yeah.
Those aunties sort of support are not there anymore. And I appreciate, Leila, what you've said, because it kind of leads us to what B is going to talk about. B, we're talking about now identifying, because if you hear of a mother killing her kids, you cannot even start to understand why she
Yeah.
would get herself to that position. And we're trying to talk about how do we how do we screen this? What should happen after a positive screening or suicide risk? How do we even start with this? There's and the way Leila has mentioned, there's stigma, there's culture, there's a way a woman after giving birth is supposed to be strong, love your kid. It's supposed to be automatic for us, right? And that's what they expect the woman to do. But let's talk about early screening so that we don't get to a point where we're seeing a mother killing her kids. We've seen even fathers killing the mother and the kids, and it's just something is not happening. B, so maybe B, introduce yourself. Let us know. We're talking about screening. How can we prevent? Let's take the
Yeah.
preventive lens. Yeah, over to you.
Yeah, thank you so much, Lizzie. I just want to say good morning, good afternoon, good evening, wherever you're joining from. And my fellow panelists, thank you so much for, just the platform and the opportunity to speak. You introduced everyone earlier on and you were saying there's experts here. I am no expert. I am simply just sharing my experience and my work on the ground. So my name is Buntle Moka from South Africa. I'm an endometriosis advocate, but that includes fibroids, PMOS, and adenomyosis, and advocating for menstrual health as a whole. And that's my space, it's mostly lived experience. And I'm the founder of the Heal Endo movement, which was inspired by a verse in the Bible, or rather, a story of the woman who touched the hem. So if you shorten Heal Endo movement, it's him. So that is pretty much me. I'm a writer. I am just a person who's trying to create a space for healing, for young girls, for women to feel that even though there's no cure for endometriosis, even though they may deal with whether it's maternal mental health issues, chronic pain, chronic illness, there is still purpose, there is still wholeness and healing in that. And I just want to hold space for, mothers and women like Layla who have gone through pregnancies and lost babies, and those who didn't get to hold, their their beautiful bundle of joy. So I want to hold space for those people. In terms of early screening, I think it starts with talking about everything early on. And when I say everything, I mean understanding your cycle, understanding your hormones, and when you're empowered, when you're educated from a very early stage, and when I say educated, I mean actually put it in schools, put it in the home, not just left for mom and daughter, but everyone in the home. I love that we have a male perspective coming on later on. It requires inclusion of everyone in the community and everyone in the society to be having open conversations. So I think screening doesn't start when you find out you're pregnant, or when you have given birth, or when you're already a mother. I think it starts very early when you're still learning about your cycle, because simply knowing what's going on in your body. There's a doctor, I love watching her stuff. She's called the Period Doctor on Instagram, Dr. Karis Chambers. She shares that when you have information beforehand, you can ask all the questions. You can be confident enough to know that I don't only have one option. So it's important to start there. But I know that when we don't have education that is firstly maybe culturally appropriate, we don't have enough of it, we are very limited in terms of, I think, the African context. It makes it difficult then to be empowered then when you are speaking to your doctor. And again, like I said, I'm no expert, but I happen to have navigated my own health issues, and a lot of women who are mothers and have had these, maternal mental health issues deal with a system or society where they are either not given enough information and they don't fully understand their body, and so they don't know when there may potentially be a drop in their hormones, so we can't identify who may be potentially at risk. And then we just don't have enough information. Women don't know what to do, what to look out for, because again, I think Layla mentioned, we are expected to go on even when it comes to starting your period. So from that early stage of just starting your period, starting your cycle, I think we need to be empowered to know what happens in your body in terms of your hormones. When is there a drop? When is there an increase? What does this hormone do? And that can, have a domino effect into how you navigate, I believe, maternal mental health. And so we tend to just leave it at when someone becomes pregnant, but I think it definitely starts so much earlier. And it also starts with believing in women, because then we can be empowered, we can know everything going on in our bodies. But then a huge part of my work is believe us. If I tell you I'm going through this, believe women. And we need to break those barriers culturally, in terms of religion, just a lot of the unique barriers we have in Africa that we have a long way to go. We've come a long way because we are clearly having this conversation, but I think we still have so much work to do, because I do believe that menstrual health, endometriosis awareness, all of these things are mental health prevention, suicide prevention, I will even say, because then we get to understand PMDD, we get to understand what is not normal. And while it may be common, it's not okay to just push through and continue. So having the courage, the space, which I think a lot of women don't have, to voice out that this is what I'm going through, especially in those moments where women give birth and then they don't have support around the clock. You find that some go for their 2-week checkup, everything according to maybe the chart or script, they're fine, and then they go about their way. 6 weeks later, we're not checking 6 months and a year, 2 years. And if I'm not mistaken, again, I'm not a doctor, but just being on the ground in women's experiences, that is the places that they lack support. And in the hidden, quiet times when partner has gone to work, or when they have to get up and go back to work themselves because there's no sufficient job security, and so there's the letting go of the baby and the moving on. And then even with loss of babies, you just, there isn't enough space for you. You kind of have to just keep going because you're a woman. We're still having to unlearn those things. And I will say early education is a big thing that I truly believe is a huge step in screening, early recognition, and that means early intervention. We can do something about it. I don't want to, I can talk about so many different things.
I know. And I appreciate the comments that are also kind of coming in.
Yeah.
This is a crucial discussion. It's actually also very emotional, to be honest. And while we were having this discussion, because I'm an aunt of 9 nieces and nephews, and I can imagine what my sisters were going through. I did not say it because I'm younger, so I did not say it, and I did not understand it. And I thought, yeah, they're doing it, they're making it look like it's so much easier. But having this discussion, then I'm starting to identify that something was not right at this particular moment. But thank you so much to the people who have joined online. I'm seeing people from Kenya, from Mali, from South Africa that have joined, and also very familiar advocates on the space, just writing and giving comments. And I know somebody just mentioned, and I think this was when B was talking, that believe women, we have so much work to do, but seeing the progress is so encouraging and insightful. And I know also Martha was like, beautiful panel. This is a decent conversation to have. Thank you, Bekti, for joining. Very important to know how your hormones as a woman operates. And we don't want it to look like this is a woman issue. Honestly, there also the support system that we're talking about, and the role that the male plays within this particular beat. And I appreciate having men joined in, because it also kind of helps talk about how they identify, and how you can actually start identifying that the lady, the woman, is going through something and they need your support, and you just being there and letting them be themselves is better than asking them to stay strong and not cry or anything of that sort. So thank you so much for joining. Keep the comments coming in. I know there was a question that Layla had actually started off, and she asked, what does maternal mental health mean to you as an individual? So feel free to also leave your comment, and we'll kind of circle back to it. I've seen Tanzania has joined, so thank you so much. So B, you talked about looking at the preventative aspect of it, and we're talking about screening and trying to also identify, but also letting women understand what they're going through, because when you start having your menses, your body changes. And I know, coming from a family where we were mostly girls, my mom scared us with, you've started your menses, you will get pregnant. So that was one of her preventative angle of threatening us into not kind of involving, getting involved with the opposite sex. And ideally for her, she knew that would work, because she wants to instill that particular fear, which is also like a preventative aspect. It worked for her, I think, to some extent. But I'm going to bring Doreen into this conversation, Doreen. And Doreen, also, you're a young mother. You kind of had your baby a little bit younger in the years, but you're a mental health advocate. You're working with amazing organizations, and out of your lived experiences, you're seeing how you can actually push into having that mother's experience become an open field for speaking. So we want to know, Doreen, from your side, was there any bit of, you felt like you couldn't openly talk about what you're going through? Was there any sort of support that you needed most, or that mattered most, that you got or did not get? And how can families and providers respond without judgment or stigma? Because the way Layla mentioned, this is a collective environment. We have aunties, we have family. I mean, a baby is coming into our community. How can that structure be more supportive? It would be good to hear from you on what your experience was. So I'll let Doreen introduce herself, because I will do such a horrible job if I do that. So Doreen, over to you. Introduce yourself and let us just walk the journey with you.
Oh, thank you. Thank you very much, Lizzie. My name is Doreen Otieno. I'm a mental health advocate. I'm also a program officer at Nzumari Community Initiative. And I also train youths to acquire entrepreneurship and also employability skills at Shining Up for Communities. So first I'll begin with my experience as a mother, because most of the time you are told that motherhood should be joyful, or it's a journey that it's mostly joyful, or has experiences that maybe make you believe that, yeah, this is what it should be. But from my experience is that sometimes you feel overwhelmed, you feel exhausted, and you also need somebody to support you, like in terms of the emotional support. And also sometimes you also feel lonely, like you are isolated, because sometimes during the journey, maybe you lose some friendships, especially when the pregnancy was unplanned, or it's something that happened without you maybe being prepared for. So I think as families and also as healthcare providers, number one, we should be compassionate, especially to young mothers, because most of the time we unintentionally maybe harm them through maybe our words or our actions, especially when they are seeking services or support for maternal care. So I think that is one thing that we should change, and also giving them a listening ear, because sometimes, just like I said, there's that feeling of being overwhelmed. You are a mother, is a transition because you are now in charge of taking care of somebody else, and this is a human being who needs your attention, your time, and everything. So sometimes that journey is not easy to transit from just being yourself and also having someone by your side. So I also feel like you need somebody maybe to walk you through the journey, and also having somebody to check in, routine checks, checking how you are faring on, and also especially when you need support, also having those places where you can get support easily, because I think also accessing mental health services sometimes is a challenge, because maybe you find the services are also expensive, in that some of us cannot afford to get those services. And in that case, I would also like to recommend that if also mental health screening can be included maybe in the antenatal care or the clinics that we have, and also having community outreaches that are mostly about maternal mental health. Yes, because sometimes we focus so much on the youth mental health, but forgetting also these other group of mothers and also women who are in their motherhood journey. So I think that is also key to include that, and also let us not make them feel ashamed of being a mother, because I know we have different views or different aspects of motherhood, but yeah, everyone is unique and the experiences they are having is unique. So I might not struggle in my journey, but another person might find it difficult to transition through the journey. So yeah, that is what I think should be done. Thank you, Lizzie.
Yeah, and Doreen, before I lose you, before we move to the next speaker, actually, I do appreciate the fact that you work with Shofkot, one of the amazing organizations. I knew that it's community based, and I know that 18% of adolescents, become young mothers. Especially, that's one of the statistics in Kenya. So, in your line of duty, Doreen, and working directly with communities and working directly with adolescents, what what is that key thing that you feel like needs to be changed if we are to reduce having young women and getting pregnant early before their age, especially if they cannot take care of the babies, especially? What would you think, or in your line of duty, what looks like those key issues that need to be addressed as soon as possible so that we can make progress?
Okay, Lizzie. So first of all, I recommend that maybe we have open discussions, especially with young people first, so that they may understand first their bodies. They may also understand maybe what motherhood is before maybe they become mothers. So most of the times, things that maybe make bring about these early pregnancies or teenage pregnancy. Number one, you find that poverty being the first reason, because sometimes getting a source of living, like how these people can sustain themselves, maybe can put more pressure on them to enter into relationships that are harmful to them, and also in the end they become teenage mothers. So I think things like unemployment, things like poverty, also access to reproductive health services, because sometimes you find that there might be some discrimination or maybe stigma, especially when it's an adolescent seeking some services. So sometimes also, if you can limit that, like make them feel welcomed, encourage them, talk to them, listen to them, because they also have their needs. And also, as parents, we also have a duty to also be with our children also. And I
Sure.
think the discussion should start at the family first, before we look into these other areas. So as parents we also have a responsibility to also have these open discussions with our kids, so that they may understand before they learn from the outside environment. Yeah.
That is so true. So I really do appreciate people joining. So thank you so much. And of course we're talking about maternal mental health, and we're trying to break the taboos. We're trying to openly have this discussion. But the beauty is we're having this discussion from an African context. We're not looking at it from a white defined problem anymore. It's not a white man's issue anymore. We've been going through mental health. It's just we didn't have structures, or we didn't have, the wits of identifying that this is an issue and this needs to be addressed in order for us to kind of prevent a lot of issues like suicides, depression, you name it. So we're hoping that this discussion will also help you have like those quick wits of identifying when there's an issue that needs to be raised, especially if it's a young mother and it's a new mother. Maybe it's their first time, or that kind of support that they need to be given. But as I mentioned earlier on, I really am insisting this is not a female conversation alone. We have communities, we have families, we have partners who are also supposed to be supportive. They're supportive, and that's why we have Brian on this call. I know a lot of people were like, why is that guy there? It doesn't look like this conversation fits him. But we understand Brian has done so much. He works with communities, he understands the setup of families. And I know I'm prying so much, Brian. I'm so sorry, but I'm going to bluntly ask whether you're also a dad, or just to see whether there's any sort of experience, or you're wishing to be a father in the future. I'm sorry if it's inconvenient and I'm like pushing so much information out of you. But Brian, just introduce yourself and then take us through that supportive mechanism that Leila mentioned and B highlighted, and Dorina's talked about setting up the supportive mechanisms. So how do we build supportive families and communities? And what role do partners, especially the opposite sex, play in this kind of discussion? And being a community, in terms of community health workers and community leadership,
Yeah,
what role do they play? So I'll let Brian come in and just share a
yeah.
little bit from that lens. Over to you.
Thank you very much, Liz. My name is Brian Jobita. I am the director of Madeba community-based organization in Kisumu, Kenya. Madeba is a youth-centered organization. Initially, it was youth-led. Actually, it is still youth-led. I'm the only one who is not a youth.
I
But
was going to ask. I was like, Brian, you don't look like
when
you're
we founded
18
the
here.
organization, we were all youths. Actually,
Okay.
Madeba is 3 years old. By then, I was also a youth.
Oh,
But everybody else is a youth, which means youth leadership is 99%.
okay.
So it is a youth led and youth centered organization. As Madiaba, we deal with the young people, and I want to thank you very much for inviting me to this platform to talk about maternal mental health. From my experience, I know this is cross cutting, but we have a specific lot of women that are normally most hit by this issue of maternal mental issues. One, the widows. When you're a widow, everybody expect that when your husband die, then you are done with giving birth. Then all of a sudden, people see you are expecting. So you can just imagine the kind of mental torture the widows undergo in the community. We also have the single mothers. Everybody assume that single mothers actually should not be expecting. That is how people assume in the society. And then all of a sudden, people see you going to the clinic. You can just imagine the stigma in the community. And the teenage mothers, especially the young girls who are able to expect before their time or before they get married, that they're one of the worst hit in the community. And then the long distance couples, especially women, we tend to question a lot, especially when you and your husband and your wife, I mean, are staying apart, and then all of a sudden, your wife is expecting. Maybe you visited once and impregnated her, but you won't take it. You'll assume. And nowadays, DNA has become so much available. So this one touches women a lot. So, as a community gender advocates, we have sampled this group of women that the most affected in the society. So, As Madiaba, actually, we have been trying to work with the stakeholders to map these women. Even right now, there's a proposal we are doing about a hub where maternal mental health education is going to be one of the desks in that hub that you are working on. So what I'll share with the panel is men need to be involved, because the number one factor that is bringing stigma on the issues of the maternal mental health is the men, especially those group of women I've counted there. The people who start such discrimination are the men. So to help on this issue, I think men need to be involved 100%. And I can see you took the first step by involving me as a man in this discussion. Just to answer you, I'm also a family man, so I understand it. Actually, I have to admit, there's a time I also had to put my wife through this. That is that really my son? Because it was when I got married, it was too early, and then she got pregnant. So, just like all men out here, we tend to normally question when women are expecting, especially because men do not have the calculation of when should a woman give birth from the time of mating. So this mathematics skip men a lot. Actually, I have male friends who have admitted to me they even take their children secretly to do DNA without their mom being aware. So you can just imagine what kind of stress the woman was undergoing before and after. So to also respond to the topic of the discussion which you put me on the role of the partners, I think the major weakness we have as partners, there is no coordination of organizations doing this thing. You'll find another CBO pulling the different direction, another organization pulling differently. So I think, especially the partners that have the resources, first the government as one of the partners should be able to identify organizations dealing with maternal mental health issues, map them, bring them together, and form a sector group. When a sector group is formed, this one is going to avoid a lot of duplication because the resources are limited. There's no day we'll say we have enough resources. Even if you're an organization that is funded more than 100%, you'll find that you still have a shortfall of resources. So if the government can create a sector group of organizations dealing with maternal mental health issues, and then every partner be given a specific role to play. For example, if Madiaba is told to handle the teenage mothers that are affected by maternal mental health issues, Shofco maybe will handle the widows, World Vision maybe will handle single mothers. So you'll find there will be no duplication and the least resources will be effectively used. So that is the role our partners can help play by helping the organizations come together, know each other, form a sector group to help in addressing the maternal health issues. Another issue I'd also like to put across is the community health workers. They play a very important role because currently the community health workers, you'll find each of them are given a specific number of households to take care of. For example, where I come from, Nyalenda A here, you'll find that all the community health workers have been given 100 households to take care of. So these community health workers are very instrumental. The only thing is they tend to also not work with other government agencies, for example, the assistant chief or the village elders. These people also tend to pull differently. And it takes me back to the issue of the sector working group. That one was about the NGOs. Now I'm talking about the government departments. They also need to work together. The village elder, the community health worker, the assistant chief, or the chief, and even the area MCA, they need to be pulling in the same direction so that if a community health worker has maybe 10 cases that of women who are affected, the chief should be able to have that data or the village elder so that when there's an external assistance, it's easier to identify and address the specific interventions. Um, I don't have much to add, Liz, except I
Yeah,
will say the village, the religious, the religion, or the
yeah.
beliefs, the religion leaders.
Hmm.
Actually, the religion play a very important factor in the society. So I think if we involve the religious organizations, it can also help address the issues of the maternal mental health, because I believe today the government is trying to bring sanity in the religion sector.
Hmm.
And I happen to hear, although I'm not sure, that the government wants the religious leaders to have some basic education on theology. So I think the people who will be setting this curriculum actually need to factor in the maternal mental health as one of the scriptures. I believe there's a way they can correlate
And
somewhere.
yeah, incorporated. Yes, and
Mm.
I know I appreciate the way you concluded with religious leaders, because African countries were religious and were cultural. So there are those two forces that really do play a key issue. And thank you so much, Brian. The way you've broken down the different people who are of interest when we're talking about maternal mental health, you brought a different niche that I wasn't looking at that particular point, which is the widows, the single mothers. You've said the adolescents, which, with of course, culturally they're not supposed to be engaging in sex, and that's what even religion teaches. So this group where things are happening, and culturally it's taboo, and it kind of makes everybody else judge you in the whole process, which brings in that mental health aspect and the shame and the stigma that we've been talking about. So thank you
Yeah,
so much, Brian, for just bringing in and also highlighting how men also perceive the pregnancies. I mean, because for women, we're happy we're pregnant, but the man is also questioning, is this my baby or not? So there's a lot of back and forth, and also the fact that there should be a lot of mapping. I know openly talking in organization, also accepting that mental health is a key issue that needs to be addressed. It's something that is, it's still fairly new. We're going through the teething process, but I know the East Africa Community Mental Health Network is here. You can share your contacts on the chat, EAC, MH, please. They're also mapping and kind of trying to see who else is within this particular space, and of course in collaboration with Sis the Light Foundation that's hosting. So this is a good thing. Let us map, let us know who's in that field, so that we can collect our efforts together. um Now this is where it gets very technical. We've talked about experiences, and we've talked about what needs to be done, and how community is dealing, or how we can try and identify and even prevent you know um suicides and stigma and all of that, when we're talking about maternal mental health. But there's always that technical aspect of it. There's also the psychiatry aspect of it, the clinical aspect of it, that really comes into play. And I know Doreen mentioned that we don't have enough funding for you to actually access psychiatric support, but then we don't even have enough psychiatric experts within the countries and within the continent for us to actually say, you know what, you can seek support. But we do have Dr. Salama Waits here, and Dr. Salama Waits is a psychiatrist, so we're so excited to actually have a psychiatrist in the room who can also kind of like bring in that governmental aspect, the policy aspect, the financing aspect, and how maternal mental health, especially mental health, can be integrated into daily routine when it comes to healthcare, to public healthcare and stuff. And we are going through a phase where most of African countries are kind of taking back the public health space, and they're literally kind of setting up all this policies and all the structures to ensure that they are the go-to places when it comes to health for especially women. And I know in Tanzania, the president is the champion for maternal health, so that's good. We're seeing governments kind of getting involved. But Doc, I'll bring you in. Maybe you can introduce yourself, but let us know, how do we ensure, or how is it going to be? Has it been integrated already into the daily routine of public health systems, or is this something that it's still a teething process for a lot of countries? So maybe you can start by introducing yourself, and really appreciate it, you spend kind of like sparing time to be here. Over to you, Doc.
Okay, thank you, everyone. It's a very interesting discussion, and I would like to thank all of you. The story that you shared is very important, especially Layla. The strength I can see from what you passed, and it's a very good experience, and the lived experience that matters most than our clinical knowledge, because you shared a lot and you point out the way forward. So from my clinical perspective, I would like to share some of it, and to introduce myself. My name is Dr. Salam White. I'm a general psychiatrist currently working in Addis Ababa, and we face different kinds of mental health problems, and most of it is women, and also be it substance use disorder, be it addiction, be it depression or bipolar disorder. If any of the substance use disorder or any of mental health problems starts from childhood, and that goes deep into the maternal well-being. If the mother is not well, if the pregnancy is not well, and if post-pregnancy, postnatal maternal mental health is not well, the baby will not have a good attachment with the mother. And if this attachment is distorted, all these mental health problems will arise. So today discussing this important topic is the baseline for all mental health problems. And with that, and starting from the point of view, this mental health start and usually before pregnancy, and while mother is trying to conceive, then after there are different changes, hormonal changes, physical body changes, then role transitions. I think a single woman then go to uh, a mother and start to have to care for a baby, and it's a very very rapid progression of change, and there will be sleep problems, there will be appetite problems, and there are different things that she's dealing. So as Leila even mentioned, now a government is trying to working with the WHO, and in most of African countries, the maternal health is uh, being worked widely, but it's not integrated with the maternal mental health. So most of the pregnant women will visit clinics for their pregnancy follow-up, but they will not be checked how their mood is, how their sleep is, how they are feeling. So these are very simple questions that should be addressed while they have their antenatal, postnatal, and well child visit. So what is being advocating currently is that integration of mental health service to every system of health system is very important, because since it's not integrated before, there is a gap, because the mental health corner is some other corner and there is a physical well-being. So we must differentiate this, since it's one person that feels this and goes through this. So integrating is one of now a new way of approaching a mental health problem, and this goes directly to maternal mental health. So it's been advocated that currently is planning to be integrated to the ANC follow-up, well child visit follow-up, and abortion care, and different types of maternal health services. So that, but it really needs integration, and the gap is very wide. There are not trained professionals as much, since from community health, community workers to primary health care and to tertiary health care. So integrating this is the way forward now, and I think the WHO and all the government and also the maternal stakeholders are working towards it. And as a general, we recommend to integrate it. Now, currently, the practice, as you all know, is if there is a visible problem, if the mother is having severe psychotic symptoms or severe suicidal behavior or aggression or some kind of infanticidal behavior, she might be linked to a psychiatric center or a psychiatric clinic. Unless otherwise, this is overlooked most of the time. So integrating to the ANC follow-up checklist, the mental health checklist to be integrated into the maternal checklist is the way forward, and it's being in the process to be integrated in our setup, and that's what we recommend to all the maternal service givers. And in the meantime, also I would like to appreciate all what you are all doing, and it's also our part to promote what does this maternal mental health means? How do we approach it? And what are the symptoms? When do we expect the symptoms? How is this going to be managed? Should be informed widely, and we have to work it together how to promote this. Because if someone knows if this is a problem, this is the first symptoms, they might seek health professionals before the worsening of the symptoms. So I think this is what I recommend, and this is what is being going. But it still has a very wide gap, and it's up to us to work together and to promote it and to fill these gaps
Yeah,
and
and maybe
open
Doc, you
for
could
every
also,
suggestion.
yeah, maybe before you wrap, you kind of conclude, I wanted to know about, I mean, you're a general psychiatrist, and I needed to know the ratio of psychiatrists to patients in Ethiopia. Is it something that is also as alarming as what we have back in Kenya, or how are your numbers looking at? Because we're talking about support, and looks like if it's integrating, then that means we need to have the healthcare professionals also available. So how is the state in Ethiopia in that case?
Yeah, the general psychiatrists here in Ethiopia are around limited to maximum 400 to 500 psychiatrists maybe. But there are different mental health workers, mental health specialists, which are nurses mastering on the mental health service, and also there are base C nurses. These numbers are a bit higher, and also there are different training that's being given to it's called me- mental health gap, MH gap, which they are trying to identify the gaps from primary and from community, and to link it to general hospitals and tertiary hospitals. So, but the general psychiatrists are limited, but there are different professionals trained to practice in mental health in our country.
Oh, that is quite interesting to know. Maybe Leila, you can let us know whether that's the same situation in Burundi.
Um, Thank you. First of all, here in Burundi, going to the psychologist, first of all, it's
Mhm.
still seen as something that is not good. It's like you are a person with a mental illness who is running in the street. So it's characterized as that. So one of the thing that we do in Shamika to prevent that is that we have a group where women's 4 or 5 women meet together with a psychologist, and they share their experiences. And while they are there, each of them is hearing the experience of the other one, and the psychologist is already there and screening each of them, and they are coming to get they are used to him or her, so that even after the program, after the 4 months and or 5 months of being together, when they feel like we want to continue going to search for counsel, to the psychologue, or any other person, they are already used to that. They are not being afraid of how the community will talk about that. And about what Mr. Bryan said, there are some churches now that they involve the mental health program in their program in a church, and they invite people with like psychotherapists. They invite them, and they share what is the mental health. And there are also many churches that are like leaders that are being educated about mental health, because when they are doing counseling, in other words, they are also dealing with that mental phase of the person, of the mother or the man. And another thing is, like, I want to add also to what Brian said. We need to emphasize on that a lot. We need also to 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 come together and to educate men also about the maternal mental health. Like, for my experience, people were coming and telling me what they want, but no one was coming to say, like, for example, they were coming to me and say, like, uh, you see, you have seen that you can get pregnant, you can give life. But no one was coming to tell that to my husband, because in the community there are words that you cannot come and say whatever you want to a man.
Amen.
And
Yeah.
when you have a man who does not understand how you feel, it kills you a lot. So what we see is like, first of all, in our community, men are not aware much more about the maternal mental health. And it's like they're saying, even the community, they're saying like, you are being childish.
Mm.
It's you are being childish, so you have to grow up. And also in the community, in the healthcare system, the first person to see how the maternal mental health is to the woman is the doctor or the nurse who is talking to her. She's the first
Okay.
one to screen that and to refer to refer her to a psychiatric or any other person who can be in charge of her. But uh, we have saturated people, women in our public hospitals, that human part, that you emotional part is not very emphasized on. And much more, you will see that they are not aware of that mental health. It's
Yeah.
something that is still new here in Burundi. Speaking about mental health, it's something that is still new. And even in the hospital, the practitioners of psychology, psychiatric, they are not given room as they should be, as and considered as doctors. It's like, if that person needs you, even though if that person is not running in the street, uh, he's not referred to the psychiatric. So there is a
Oh.
lot of misconception and a lot of awareness that we do so that people may understand. And at the same time, there is this new generation where mental
Yes.
health is the core of their being. Like, we have to how I have to take care of how I feel and how I react to things. But also, we don't need to forget that there is the urban people, and also there is people in up countries who are
Mhm.
not having like, who are not in this chat, like who are not in this life like right now, but who are living atrocity, because and that comes to their mental health. Like, for example, if a woman can't get give can get pregnant, or she experienced a child loss, that she will be referred as a witchcraft. She will be thrown out of her home, and her family will say, we will not let you come back in our home because you are in disgrace." So that woman will have it will have consequences on her mental. And also, if she had like several miscarriages, and then have two
Mhm.
babies who are alive, she will try to, even after having kids who are alive, she will try to get pregnant so that she can say, like, those babies I have to replace those miscarriage that I had. So this
Mm.
is
Okay.
something that is coming also to harm her physical health, but mostly her maternal mental health.
Yeah, the
So
mental health aspect. Yeah.
yes, so we are trying to involve the communities workers so that they may be aware, first of all, of that situation, and so that also they'll have to understand, because understanding and being passionate about it helps. If you
That's
understand
true.
well what's maternal mental health,
Yes.
and
So
you
true.
give it to your heart and passionate, you will exercise it very well. But if
And
yes, and
yeah,
if you do,
and sorry, before you conclude, because I think I'll lose my that process. Somebody just highlighted something, and I'd want B and Doreen to actually kind of comment on this. And we know that there's, because you mentioned there's this new generation, and they are wired a little bit differently. So Jolie says it's key to have communal post baby showers to bring in mothers together where they can share their diverse experiences. And I don't think that actually happens. We do see the gender reveal, we do have the baby showers, but I don't think ideally they use it for this, like letting her understand that this is a beautiful journey, but this and this and this might happen. And in case that happens, then you won't be the first person to go through it. I'd want to hear from you, B, and then Doreen. I mean, what are your thoughts around Jolie's comment? Because that kind of was popping up and I needed to bring it into the conversation.
Yeah, I mean, I see that comment, but I'm also, really wanting to share the important work of what doulas are doing. And I see amazing doula Josejo. If you find her, she is doula le Josejo on Instagram, and the work that they're doing, community-based doulas, the support that they give. I'm still learning so much, but from just what I've gotten to know and learn is that the support that they give is to mother, is to partner as well, and they have, I don't know in the rest of the continent, but have been given access, possibly maybe in theater, and they address issues where it's throughout your whole journey, and they are there to support you. Whereas sometimes, whether it's nurses, the doctor, they may not be able to give you that support. It's very limited in the kind of support, and I specifically mentioned her because I was watching a podcast, and she said that, she does allow a mother to call her any time, sort of that access. And so that changes something for a mother's journey. And in terms of language, I think there's language in terms of what language are we communicating in, but what people also seem to overlook is in terms of there are deaf mothers or hard of hearing mothers who's there for them, and some of the losses or some of the issues that have happened or that could have potentially been prevented was because there wasn't anyone that could communicate to them, and I think communication is a huge part of the journey and part of the support, and so I think the work that they're doing. And so even in terms of the baby showers and the community and the aunties and the mothers, grandmothers, they are, I think, standing in the space of what we've lost in terms of that. So what doulas are doing is what we maybe don't have anymore in terms of mothers, aunties, and that community that we maybe, at least myself, grew up hearing about. And now what I would lean on is potentially a doula in the community if I can access one. So I think
just a quick one, is the doula like a native South African name, or is that the name of the organization? Or
no, a doula is Josejo is gonna forgive me for this, but it's who supports you on the journey, because they have them in the UK, they have them in the US, and that the fact that it's a lot of mothers don't know they have access to care from and support from a doula. If many knew, I think it would make
that's a game changer.
The birthing, it would change the game like significantly. So I think more people having information. So when you know your options, that supports you, that saves lives, that prevents suicide, that helps you on your mental health journey as a mother. And I think, earlier on, I wanted to just jump in terms of just teen mothers, as a survivor myself, it's important also to look at the language we give and the responsibility, or, where we emphasize some of that responsibility. So in communities, we still have a lot of, I want to say, violence and sexual assault happening. So it shouldn't be just the burden of teen mother must just know, she mustn't, don't do this. It's a lot of still weight on a child. And I think when we bring in conversations with men, it's who is then sleeping with young girls, and it's important to also address, I think, that aspect of it, besides the aspect of there's poverty, there's infrastructure, and all of these kind of issues. It's important, I think, to also just remember that there's also in a lot of rural areas where the teen mothers are having to also then deal with this. And as a survivor, you're then dealing with the mental health of that, and then also of having a baby, or just the maternal mental health aspect. So I just wanted to add that earlier
Yeah,
on.
sure. Thank you so much for that. And also I'll just bring in Doreen because I know we have like 5 more minutes before I hand it over to Kanye. Doreen, any thoughts around what Jolie has actually mentioned about, post baby showers, and that's being used as some sort of a way of, also helping, especially the young mothers. Oh, you're muted. Ah, there you go.
Okay. Yes. Yes. I support what Julia said. Yes, and more of having those community groups, or maybe we call them support groups for young mothers. And for this, I really appreciate the work that our psychologists did at Nzumari Community Initiative, because we used to have support groups for young mothers, and it really gave us that safe space for open conversation and also sharing our experiences and our struggles with mothers. So I really understand that yes, motherhood is a journey, but we also need to have that support system so
Sure.
that in case you need a shoulder to lean on or somebody to listen to you, somebody to encourage you. So I'm really supporting that, especially if you can have support group sessions. Yes, they are
Awesome.
really, really important.
Awesome. And thank you so much for the doula support highlight team on that. B, that was amazing just to know that this is something that's kind of working and it can be, replicated elsewhere. So I'll bring in Brian. Brian, we're closing, and I just wanted to ask from a male perspective, what do you think other men can actually do to help with this journey? Something very brief, because I saw Onesimus kind of left a comment about negative masculinity, contributing to the maternal mental health that women are facing, and this is something that kind of picks up during pregnancy. So what would be that recommendation, or what would you advise, especially the young fathers and the men, because this is a collective initiative. If we were to go and have a healthy mother through the pre, the during, and the post natal phase, what would be your recommendation, Brian?
Thank you very much. My recommendation would be to both women and men. Actually, women should be involved in men on all matters concerning their relationship. For example, you'll find that women, they don't tell men when they want to go for the job. How do we call it? The family, the pill control, family control.
Okay. Yeah.
Yeah, you just find a man is surprised that his wife had actually put the job, and when they remove it, they also don't say. So you'll find this bring conflicts when a woman conceives, because the man will assume you told me you put that job maybe for 3 years or 2 years, and then the woman will argue it had expired or it was faulty. So in the
Hmm.
issue of the family planning, I actually tend to blame women here, especially the married couples. They should be open to men and plan together. Not that you come back and surprise your husband, I have put that job, that family control job. So this will normally
Communication.
bring
Yeah.
conflicts. That is one way of solving the conflict. Secondly, men need counseling. I don't know what policy can be brought that when the women attend the clinic, actually men should give them company so that they understand all these things in the clinical process, so that you don't only leave it to women. No, if men are involved, or if the doctors actually can find a way of involving men on this, it becomes very easier so that the man will be able to understand the process from the start to the finishing. And finally, like I said, the organizations, they need to do more of community sensitization
Yeah,
and come out of the boardroom to the grassroots where the men
definitely.
are.
Hmm.
You go where the men are, at the family levels, at the community barazas, at the farms. The organization should cut the issue of the boardroom meetings. So to me,
Right.
that will actually help in involving the men.
So it's all about involving, communicating. So involve me, please.
Yeah.
Well, thank you so much. 8 seconds into it, Kanye. Thank you so much. And what I like is I think the schools are closed, so you can hear a little bit of background, neighbors' kids running up and down. My nieces and nephews are around, and I love when they go crazy. And I could hear Doreen's background. There was a baby also. I mean, we're talking and we're going through the whole lived experience. And I'm handing it over officially to Kanye. Thank you so much for Sis the Light Foundation, ENASO, and the East Africa Community Mental Health Network for, just setting this up. And Kanye, thank you so much for, all the background support and stuff. Over to you. I'm literally done. Thank you so much, speakers. I'll hand it over to Sis the Light Foundation. Over to you, Kanye.
Thanks, Lizzie. Thanks, everyone, and everyone who's joined into the speakers. I'll try not to be too long. I think I just want to highlight an angle that I think nobody has mentioned. And I think instead of, a shameless plug about Caesar Life Foundation and why we're in this work, that I hope people can connect the dots after around mindfulness and how that's beneficial for mental health and mothers' mental health specifically. But I actually just wanted to mention that we haven't really considered how empire, imperialism, and religion have played such a dominating role in how we not only view women, but how we view life. Because if we backtrack pre-colonially, what was the value of a human life? What did we think about human life? And then where was that? What was the point in time where a line was drawn and then human life was started to be valued for imperial agendas? And I don't want to mention specific context, but I'm sure people can sort of connect the dots as to what I'm speaking about. There was a particular time in history where people cared a lot about how many babies a woman could produce, because that was tied to imperialist agendas. Now, to me, very interesting that now that we've kind of progressed the conversation, there's human rights that we're well aware of. Now women's rights are sort of being capitulated and being impeded upon in this manner. Can we be surprised? Not really, because if you look at the imperialist agenda, whose life is being mattered, it now is also informing whose life is now being funded in terms of public health and the resources. And I'd also want to mention that when we're talking about the doulas, through religion, unfortunately, women were doulas long before religious doctrine. But these doulas, so-called, I don't want to say so-called doulas because I think that that's even incorrect to say, but those women were accused of witchcraft. And, you're welcome to go and explore Salem witch trials, medical apartheid. These are all things within European context that any woman who could be seen to have the capacity and intuition to bring life and help a woman give birth was accused of witchcraft and witchery. So the men within the religious context, they captured science, and this is where the healthcare system and the public healthcare system has evolved the way it has, and how it's been captured by patriarchal ideas and masculine ideas about women and women's health. So I think for me, I always look at these things from more of a systemic and structural lens. The capitulation of women's and girls' rights, very important, because how come all of a sudden now women don't have full rights and autonomy over their bodies? We need to understand who's in charge of policy, who's writing the laws. But as I say, for me, I think the view on women currently is being informed by another imperialist agenda. And if we think about, for example, at the AU this year, within the Women's Forum, I think the theme was water and sanitation. And I don't want to suggest that water and sanitation is not important, but for the social and economic issues that we're facing on the continent, I fail to see how water would be at the forefront of anybody's agenda, right? Issues we're speaking about here, to my mind, more important, because we're talking about life and who sustains life and who's going to make sure that the population continues. But whether that is within the best interest of imperialist agendas, I'm not sure, because we do know that the population, it has its advantages about the population dividend. We've got the numbers to our advantage. Is that, sorry, Brian? Oh, okay. Sorry, I thought he wasn't responding to me. So we've always had the numbers. Is there a direct correlation between maybe women's health, women's mental health, women's rights, and the birthing rights, and how now the continent is being looked at, population control? I don't know. I'm not too much into conspiracy theories. For me, I'm just only looking at the data. And as an organization, we're highly concerned about the rights of women and girls. And in my opinion, they are severely being impeded upon. And we need to consider them, but consider them in a full context. Because I know many African scholars will say, let's not look at European frameworks. In my opinion, it's very important that we do. And as I've given the literature, please watch the Salem witch trials, look into medical apartheid, and then let us form our Afrocentric view on what woman and what life means to us. Thank you, Lizzie. I'll allow you to wrap up.
Thank you so much. Yeah. So thank you so much. We have 5 minutes into it, which is a good thing. Of course, the team also is calling out for collaboration and partnership. This is not the last discussion. I mean, for now, you've seen that we kind of hold this monthly discussions on different topics, but also just integrating them into the mental health discussions just to see how we can improve. Because I feel like even the comments that were coming in, a lot of suggestions and good feedback was coming into how we can solve these issues. And thank you so much for the people who joined online. If you would like to, collaborate, I know will leave the email so that they can reach out. Please recommend which topic you feel we should be discussing and how can we integrate that with mental health. And until next time we have this discussion, thank you so much. Have a great afternoon, a great evening, and a great weekend ahead. And remember to always keep your mental health in check. Take that step. Look after your mental health. And if you have issues, please reach out to the next person you live with. Just speak. Be open about it. There is no shame to not being okay. It's okay to not be okay. Thank you so much and have a great one. Bye.